David.
Yes.
Hello, Dr. Agarwal. How do you do?
Very well, thanks. Nice to meet you.
Excellent. So, how was your journey today?
Yeah, it was good, thanks.
Yeah. Well, thanks for coming along. We just wanted to get to know you a bit better. So, why do you want to do medicine?
Well, it's something that I've thought for quite a number of years. I'm really interested in science and been really interested in doing some sort of practical application of science. Did a lot of work experience recently, and I've really enjoyed all the different parts of medicine that I've seen in that. So it's really just reinforced that for me. I'm confident that's what I want to do.
So tell me about this work experience. You seem to enjoy it.
Well, quite a few different things. I think the biggest one, I was in hospital for a bit with the surgical team in the ENT.
Okay. And what did you see?
Well, quite a lot really. They were very good. They gave me a real chance to get involved. So I was able to go to theatre and see some of the procedures, see some patients going through the clinic, and then sort of watch what happened to them. And it just seemed like I could see a lot of what the team, what was going on with the team. I could see the difference that it made. And it's something really interesting. I was interested in getting to read about some of the procedures and how it all works, and the theory behind it.
Good. And so you were the ENT team, and it sounds like you're observing that. Were you actually doing anything?
Not really. It was very much. It was mostly observational, to be honest. They were always trying to involve me. So I could kind of ask my questions and talk about it, but didn't really get a chance to do anything practical, so to speak.
Okay. So I mean, that sounds excellent. So is that something you'd be interested in as a career?
Possibly, yeah. I mean, it's still early to say. I want to make sure I see a good sample of everything first.
Yes.
But it's definitely something that's something that's, from what I've seen so far, really interested me about stuff. It was really fascinating specialty.
So would you ever consider other specialties, such as nursing, for example?
Well, I hadn't so much thought of nursing.
Why is that?
I mean, it's a really worthwhile job. Nurses have a hugely important,
absolutely,
a hugely important job in hospitals. But I think it's like I'm sort of approaching it more from the sort of scientific end and saying that I'd like something more intellectual challenge.
But then why not be a scientist?
Possibly, I mean, it's a fair career path, but from what I've seen in my work experience, I think I'd like to work in a hospital. It seems a very worthwhile thing to do. It seems a good kind of applied science, a good practical application of science. It's something I feel I'd really enjoy.
Okay. And so why have you applied here specifically?
Well, a few reasons. I really like I do the integrated course with going to early patient contact. That's something that really appeals to me, especially having from my work experience, seeing being with patients and seeing the sort of the clinical side of it there. I just think it'd be a long time to wait. So through 2 or 3 years of just doing science, I really want some way of getting a bit of experience with patients early on.
That's a very fair comment. But what disadvantages do you think this course has?
Disadvantage? I mean, I guess from the sort of patient integration sort of thing, I guess you want to approach patients with some knowledge, with a good background knowledge. So I guess that's something it's always a balance, but I think on balance I'd probably like to see patients as early as possible and start to learn those skills as early as possible.
So do you think for a doctor it's more important to be knowledgeable or good with patients?
That's not so. I'm not sure you'd sing those out really. I think a good doctor's got to have both. From what I've seen. All the doctors that most impressed me in my work experience are those people who you can tell they're really knowledgeable, but the patients sort of seem to connect with them as well. So I think they're both really important. I don't know how I'd be able to say.
But do you think you can learn to be a good communicator? Or do you think you're born with it?
Really a bit of both. I mean, some people find it easier. Some people are just naturals with people and it comes more easily. And again, I'm sure it's something that you can learn, especially I've seen how some of the ways that doctors approach consultations and some of the things that really impressed me. So I'm sure there are skills that over time with the right kind of training you can improve upon.
Absolutely, and here we do emphasise communication skills quite a lot. You get a lot of teaching in it. What do you think is the hard? I mean, obviously medicine is a very excellent profession, noble profession, but what do you think are some of the disadvantages of it?
Well, I guess it can be quite stressful at times.
It can.
Some of my other work experience as well was working on the medical teams. I was in geriatrics, and that seemed quite difficult at times. some of the patients are quite ill, or quite difficult family circumstances, it can be quite emotionally difficult, quite stressful.
Did you find it emotionally difficult?
A little bit. I mean, it wasn't so much because I wasn't sort of as directly involved. I could say I would be more if I was actually the person responsible. But I think just to see it did it have an effect on me.
Well, in 20 years you may well be responsible for these people's care. I mean, how would you deal with it? How do you deal with stress at the moment?
Well, I think it's important to have something as well as work. So I mean, at the moment I do quite a lot of music, so I sing with my choir, I perform with an orchestra. And I think it's having something where you can sort of go away and relax and kind of take some time away from the work. I think that can be helpful. Just like to keep things in perspective and kind of approach each thing fresh and sort of ready to.
Yeah, I mean, I was looking through your personal statement and I noticed you do quite a lot of music. Is that something you're quite passionate about?
It's something I really enjoy, and I'd love to keep it going as long as possible. Because I just think having that thing on the side, it's just useful to have something to do. But I mean, the music itself, I really enjoy it. So yeah, I performed I did a lot of church music. I performed in a lot of cathedrals around in the UK. Occasionally do an overseas tour as well. That's really
right.
That's something I really enjoy.
You're quite an accomplished musician.
I mean, okay.
Yeah, I think you're quite modest. Okay, so I wanted to ask you a bit more about situations you've been in. So you've obviously done a bit of music, and I also noticed you did a bit of refereeing.
Yes. Yeah.
So can you tell me about a situation where you made a difference to the team?
Made a difference. I think music's one of those things where you do notice, especially as a team, everyone needs to obviously be performing together. In a choir and an orchestra and something like that. Yeah, but then so there are certain times when someone will be in the music setting, so like a soloist, and then like a lot rests on that person, because if it's quite a long solo, so maybe there's no one else who's prepared, who's practiced it to the same extent. So there's they've got to make sure they're sort of there and they're on time and fit and ready to sing and there's a kind of bit of pressure for that because a lot of people are counting on you being able to do it and no one else can step in. So I think in those circumstances it makes a big difference in the team.
So what did you do in that situation? I mean, how did you make a difference?
I think when you're in that position, it's all about preparation. It's saying that you can't just turn up and just expect things to go well. You've got to make sure you learn the part.
Is there any specific instance you're thinking of?
Well, there's quite a big performance. For instance, it was in St Paul's Cathedral, sort of 6 or 7 months ago now. So I had all the solo parts of that, but that was probably sort of 8 or 10 minutes of music to learn. So that's quite a lot. Absolutely,
but some would argue that's not really a team exercise. What would you say to that?
Well, it's very much. I think it's a team exercise in the sense. You're playing one important part of the team as a whole. Like it's not all about you. It's about you. It's about the other soloists. It's about the whole choir as in total. It's about the accompanists, and it's just like that. You have an important role. That you have to do your job well. But your job alone doesn't make it. It's all how it fits in. It's about making sure you prepare to let the team down, making sure that everything kind of fits together with everyone else.
Okay. So, and obviously you've been doing that for a few years now, is that right?
Yeah.
So that's great. For the next part I want to talk a bit about the ethical situations you may come across when you become a junior doctor. Now, recently there's been a lot made of the NHS reforms. Do you know anything about the NHS reforms?
Well, from what I understand there's a lot more controls being given to GPs. So GPs are getting a lot of responsibility for how they allocate funds, what treatments are funded and what treatments aren't funded. So that's my sort of understanding of the general process.
Absolutely. And what's the overall aim of these reforms? What are we trying to do with them?
A lot of it's concerning saving money.
Yes. So, I mean, imagine, for example, you've been made the Health Minister of England. Congratulations. And you found a surplus of £1 million. Now, you have the choice of spending that on to invest in an MRI machine. Do you know what an MRI machine is?
Yeah, so I saw them in the hospital. In the NT they use it quite a bit actually, there's some of the imaging.
Yeah, fantastic. So it's an imaging machine. Or you can use that £1 million to perform a few operations, specifically operations to help with operations for liver transplants. And the caveat for this is that they'll only be used for patients who've been suffering from alcohol-induced liver cirrhosis. Okay, and it's your choice now whether you choose to spend on the MRI machine or the 50 liver transplants for the alcohol patients. What would you do?
So you've got lots of the money, and it's either you have to decide either an MRI machine in a hospital, and there's any upkeep costs to that, or
yes, so they'll be maintained by the NHS Trust.
Okay, so you either have the MRI machine or you don't have it and you do the operations.
Yes.
What would happen if you didn't do the operations?
Well, do you know anything about people with liver failure?
Well, I mean, to an extent, the liver can sort of regenerate. You can go back a bit.
It can. In these cases, people who require liver transplants, they will almost inevitably die if they don't get that transplant. So yes, what would you do?
Well, I guess you've got to kind of think in terms of sort of time scale, because it would concern me to neglect the transplants that they do, because that's 50 people, that's 50 lives that would be lost if you didn't go that route. But then again, you have to consider how many people the MRI machine could help. It would help far more, but would it have such a big influence? As I took on this actually. So if you go with the transplants, you'd save people more directly. You'd save 50 people directly. I guess it comes down to sort of how how useful the MRI machine is. I mean, obviously it'd be a huge patient throughput, but how much difference would it make to each one? Sort of balancing the benefits, which one will give more benefit overall.
What do you think?
It's hard to say really. I mean, I'm always kind of concerned to kind of neglect the people who need the operations. I always think that that's probably more the way I'd be swinging towards doing the operations. Just thinking that for those people it's really important, they're defined people, whereas for the MRI machines there's a kind of futuristic sort of thing, and maybe there could be some other way of diagnosing what the problem was or something. So obviously very hard to say, but I think maybe I'd lean towards the operations, just thinking it's more directly, it's doing good more directly to those people.
Well,
really harm to them.
I mean, there was a caveat to that question, which was these people are alcoholic, so one could argue it's self-induced. Would you still do it?
I mean, it is self-induced, but I think it's a really difficult line to draw. Like if you say, that's self-induced, that person doesn't deserve treatment, then where do you draw the line? What about it could be smokers, it could be people, but then it could be anyone. It could be that someone's just on a good diet, or someone had a sporting injury or something. I just think it's really dangerous. So I don't know. Would it be relevant? I feel it shouldn't be.
So do you think it's fair that we discriminate, or should we try and aim to treat everyone equally?
I think the fairest thing. I mean, it seems to me it's more fair to treat people based on what they need, rather than sort of kind of on the basis of who deserves it, just to say who's going to make the most difference to me. Ideally, there'd be enough resources for everyone.
Yes. I guess that's what the reforms are all about. Okay, well, let's move on to the second scenario. So this is not an uncommon situation. So say you're the junior doctor on call on a busy A&E shift, and an ambulance brings in a 16-year-old girl. She's lost a lot of blood because she was involved in a road traffic accident, and she needs a blood transfusion urgently. Being a good doctor, you attempt to start the transfusion only to hear her say that she's a Jehovah's Witness and doesn't want a blood transfusion, what would you do?
So, how old is she? She's 16.
Yes.
She says she's 16. So she needs the transfusion, she needs the treatment, but she's refusing it.
Yes.
Let's see. So if are the parents around? Are the parents?
The parents are on their way, but they're not here yet. They'll be about half an hour, by which time it may be too late.
Okay. So she's still a child, but is 16 old enough to make those decisions? Because I know that you can consent to treatment without, if you're if you're competent, if you have an adult understanding, you can consent to treatment, but
yes,
without your parents knowing about it, if you're less than that, if you're younger than that.
Yes.
So I guess she could refuse it if she wanted to.
Yeah, it's strange, isn't it? I mean, you do, by what you said, it makes perfect logical sense that if you can consent, the 16-year-old actually can't refuse treatment if it's in their best interest and there's no other person around. So in that case, it would be fairly straightforward. You would transfuse, obviously try and find out and let the parents know. This becomes slightly more complicated if they're a 28-year-old, for example. What would you do then?
Well, I mean, I guess they do have the right to refuse treatment if they don't want it. They have to. I mean, to make the decision, they have to understand the situation. They have to understand what the problem is. If, for instance, they thought it was a minor thing and they were refusing it, thinking it was minor, when actually it was a really important thing. It was potentially having an influence on their life. It wouldn't then be a valid decision. So they've got to make the decision. It's like they could be informed, but it's got to be fully informed. But I guess you could refuse it though if you knew the consequences, and if you knew what were the consequences of not having the transfusion, and she decided that she didn't want it, then she would have the right to refuse it, surely.
Oh, possibly. Well, I think that's all we have time for. Thank you very much for coming down. We'll hear from us in a few weeks.
Thank you.
Thank you.
How was that? It was quite tough actually. I mean, I thought things started okay, but because I was prepared for those sorts of questions.
Yes.
I was expecting to be asked. I was expecting to be asked why I applied here, and I had an answer prepared.
Yeah.
But then when it came down to the ethical types of situational things, I found that really hard. They're really tough decisions. I don't know how to best approach those.
Yeah, I mean they are tough questions. I think I agree with you. You started off very well, very strong. If anything, you were almost too quick to answer some of the questions. I thought you could take slightly more pause.
Okay.
Because we were speeding through a lot of the questions initially, and it almost gave me the impression you'd rehearsed these a few times too much. But in general, your answers to those were very well constructed and quite personal to you, which was very well, you were quite well spoken, good body language as well. When I asked you about the situational question, I asked you to tell me about the time when you've worked in a team well, shown good teamwork. How did you think that question you were asked that was?
Well, for me, I was just trying to think, of a circumstance. Because the teamwork strikes me. I do a lot of music. It's all sorts of teamwork, but to think of an exact situation, because there's that balance between individual and teamwork. Because the more team it is, the less potentially the less of a role each individual has. The more it's kind of the sum of the parts. So I wanted to try and think of something where it was about everyone, but where I had a particular responsibility or a particular role. So that's why I tried to focus it on that where I was supposed to be.
Do you think it was quite focused, or do you think it could have done better?
I felt it took me a while to get into.
It did, and I kind of felt you were rumbling for the first part, not just giving me specific. No, there's a really simple thing you should do with these: is you should set the scene And he said, this was my role and this is where I was.
Mm-hmm.
And then he said, this is how I made a difference. And then the final part is what you learned from it for the future. Because I was kind of getting, I did get all the information, but it was quite pieced together and all over the place. I think just slightly more structure there would have been quite good. Is that fair?
I think so. I just, if I had a better structured approach to it, I think maybe it would just, it would have flowed a bit better. I would have been a bit more clear in what I was saying. So I'll really bear that. So like I sort of started by setting the scene.
Yes.
And then talk about the situation itself, so what you actually did.
Yes.
And then sort of
like
like
how it made a difference.
Observation.
And then improved the result or what the result was.
Okay, that's right.
So and you can apply that for all these. So tell me about time you showed good leadership, good communication skills, made a difference in the team.
That's really
And if you have a complex example like you did, then all of these are actually very valid. Fine. Let's talk about the ethics. Now, the first ethics, I think you did. I personally thought you tackled fairly well. I liked how you got more information out of me. That's a very well done. How did you think they went after though?
I think the thing is with the second one, I don't think I knew exactly the legal stance. I knew about consenting to treatment, but in terms of refusal, I didn't know exactly where the legal stance sat.
Well, this was an ethical situational question hybrid. Now, before we've gone to the Jehovah's Witness question, I want to go back to the MRI imaging. There are a few ethical principles you must know, and if you know that you can answer 95% of the ethical questions you're going to get.
I think I did read something actually.
Yeah. So it's a paper written by Beauchamp and Childress in 1982. But I think it was 1982. The important thing is there are 4 or 5 principles you need to know. Have you heard of it?
Yes, actually, I think that's to do good.
Yes.
Benefits the
Absolutely.
To avoid harm, non-maleficence. Patient has the right to choose.
Yes, autonomy. And then the final one has justice.
So,
justice. In those, what the best way to do, and this will be covered in your tutorials later today, is to think about which ethical principles are actually relevant. So the most important one there, which one do you think it is?
So, I guess it's avoiding harm.
Possibly even more important.
Justice?
Yeah, I'll say so. So instead of, you don't have to do it explicitly, but I think if you use that framework, it allows you to cover all your bases. So that's a really useful tip. So you state the question, try and recruit as much information as you can. Pros and cons using the ethical framework, and then finally give your own opinion, which you did at the end. I think the Jehovah's Witness, you kind of fell into a trap because you assumed that because they were a Jehovah's Witness, they couldn't have a blood transfusion. Can you think of any other reasons why they would want a blood transfusion?
It could be like a lack of understanding about the procedure. It could be that they don't understand it's important. They think it's unnecessary. It could be just like a friend or relatives had some reports of really bad experience.
Absolutely. When you've lost a lot of blood, you're quite dizzy and disoriented, and they'll just be very confused or maybe fear of needles. There's lots of options. So with the ethics, when you asked me information, I think you should have actually done that in the second part as well. Okay. Because that's how you show you've engaged with the question.
Okay.
All right. Don't fall into these traps. There are scattered around. But in general, I thought it was quite a strong interview. Obviously, the first half was a lot stronger than the second, but the second half, even then, wasn't by any means weak. Right. But you've got things to do to work on.
Okay.
Right. Any questions?
I don't think that's really helpful. Thanks very much.
No problems. Thank you. Take care now.